Thank you, Deputy Speaker. Greetings to the CIC, Julius Lomalema, commissars and fighters. In a country like South Africa, where access to healthcare is drawn upon race, class, and gendered binaries, the threat of COVID-19 should have all of us concerned, as we can already tell who will experience the catastrophe on a greater scale, more so because the first case has been reported today in KZN. Minister Mzweli Kize is adamant that the Department of Health is ready to tackle the virus. We know that this is not the truth, as a mere seasonal flu in South Africa claims the lives of 6,000 to 11,000 people per year. If your department cannot contain a mere flu from claiming the lives of our people, when there are preventative measures through vaccines and primary health care, what will you do to contain coronavirus? Majority of South Africans still do not know what coronavirus is and are subjected to fear-mongering and lack of information, and yet we have a supposedly functional and prepared Department of Health to counter a virus that has destabilized some of the strongest health systems in the world. If coronavirus can make a country like China build a hospital in weeks and yet still claim thousands of lives, what do you think it will do to South Africa that takes 10 years to build one dysfunctional maternity ward? The very little our populace that has access to internet and social media are subjected to the ignorance of ministers who have no shame in wearing incorrect masks and tweeting about their ignorance with pride. But as usual, the EFF is very magnanimous with solutions, and we will share them with the department and the minister with the hope that you will put and prioritize the lives of South Africans before your ego.
Point of order.
Yes, Honorable
Deputy Speaker, can the minister listen? And pay attention and listen. Eh? Please.
Honorable
We are giving
Ndlozi.
wisdom there. You are busy
Honorable
having a
Ndlozi.
chit chat. Please.
Honorable Ndlozi.
This is great wisdom. Listen.
Ntate Ndlozi, ke kopa ska ba ipita ntwe. Ha o ka ipita, o tla kopana le pela di falla ntate. Tswela pele mme.
We hope that the minister and the Department of Health will put the lives of South Africans first before your ego and the rush to claim non-existent easy victories like other ministers have done. The department must institute an immediate mass media campaign, this on radios, in clinics, schools, television, and do door-to-door. We know that this is possible because it is done during elections. The department and the minister, together with the Minister of Water and Sanitation, must devise an emergency plan on how to ensure that clean water is accessible to everybody. You cannot teach people about hygiene as a preventative measure when some of our clinics, hospitals, schools, villages, and townships have a water crisis at hand right now. Primary healthcare workforce, community healthcare workers must be trained for detection mechanisms. It will be a huge disgrace for the country that the very same people tasked with easing health catastrophes will also be at risk of infection and not be able to deliver primary health care. Infrastructural preparation must extend to all hospitals and not just 13 hospitals, Mr. Minister. People must not walk into our hospitals with physical injuries and live with tuberculosis and coronavirus, as is the case because of infrastructural inadequacies. Testing ports must be extended beyond white-dominated and elite spaces. The department cannot claim to be ready when the only entry testing ports we have are at airports. Majority of our people use alternative modes of transport, and our country borders don't start and end at OR Tambo International Airport. More so because the coronavirus is not contained by the imaginary borders. It was a huge embarrassment yesterday hearing the minister speak about the radio of the surveillance team and making an example of instances of infection being picked up at the airport and people being called if there's somebody who's infected on the flight. The question is, what tracking mechanisms has the department devised for townships and rural area public spaces? How will you track down taxi passengers and train passengers who were sitting next to an infected person? Pillar number 6 of WHO guidelines asserts that it is not just points of entry that must be prioritized and controlled and assessed, but also those areas that pose a high risk of transmission and infection. The minister must conduct a comprehensive stakeholders and community engagement plan of action to inspire and coordinate a multi-sectoral and multi-partnered intervention with the private sector, business, NGOs, agriculture, and travel and tourism. The department must also find out the possible monetary cost of dealing with coronavirus should it seep into the country. As we have learned today, it already has. Lastly, the entire country must be cognizant of the reality that such viruses are a bigger threat to the poor, who will not have the means to buy food in bulk and lock themselves in their houses, and that not everybody has the liberty to call in sick and take a day off at work work because they have symptoms of flu and COVID-19. We have people who are exploited workers, and they do not have the liberty that most white and classist and rich people have. It is wise to hope for the best, but it is much wiser to plan and be ready for the worst, Mr. Minister. I thank you.